let's get right into the discussion. Prem, how do you and your company think about the opportunities and the challenges in the developed, richer world versus the less resourced world?
Yeah, it's a great question, Zach. I think, the key as we think about deploying AI in healthcare is being able to understand what the needs of the different communities are that we're serving. So being able to truly understand if there's accessibility to solutions like ours, having solutions that are more cloud-based, where the infrastructure is more appeasing to be able to allow customers to have that, I think is top of mind for us. We also think about it in terms of how AI can really support and act as a force multiplier by really ensuring in rural areas or areas where there might not be access to specialists and care that they provide, we can utilize technology and AI to support and augment that. In the background, AI can run 24/7, 365 days a year, where that will allow us to provide more accurate diagnoses, opportunities to triage and detect those patients and alert providers in different areas so they can coordinate the care for those patients better.
Thanks for the reminder, because it is the case that there are parts, for example, in the United States, in the rural areas, where access to specialists is at the very best slow and sometimes non-existent. Do you have any cases where you're beginning to address this?
Yeah, absolutely. One of our key products that we've developed is for large vessel occlusion, which is for stroke. So patients that have had stroke. And as you know, that's a very time-sensitive condition where if patients are in rural hospitals or outlying areas where there aren't access to care for specialists, it can result in significant disability based on how quickly you can treat and manage that patient. We've been able to demonstrate with the use of technology like ours, you are able to reduce time to treatment and diagnosis of those patients by up to 60 minutes, which is a reduction in about 1 year of disability for those patients. So pretty significant overall. And being able to create and develop that stroke network more comprehensively with the use of that solution has definitely improved the overall quality of stroke care across the country.
Thank you. David, you've thought long about these problems. How do you begin to think about the fact that whether in the United States or in countries that have more globally lesser resources, how are we going to make AI help advance healthcare rather than just increase the quality of healthcare in the richer countries?
Yeah, thanks, Zach. Really building off of what Prem said, it starts with infrastructure. And I'm talking about real basic infrastructure like access to affordable broadband. There have been several initiatives underway that have allowed us through public-private partnerships to be able to enable individuals and organizations across the globe to be able to have access. But on top of that, when you think about AI, it really does need to be run in the cloud. You need to have the capacity, you need to have the nimbleness, the security. And so one of the programs that has been launched last year for rural hospitals in the United States was a program around enabling cloud access as well as cybersecurity. So this is extremely important because the data we know is valuable. It's something that is a target of cyber attacks. And so that is, I'll call it a layer on top of the infrastructure. But now we have just the basics. When you think about the organizations, as much as we feel the benefits of AI could transform healthcare, if you have no budget, it doesn't matter. And so one of the areas that we've been focusing on is building out AI solutions that can help enable financial health. So if organizations that are struggling can now actually generate or reduce the losses that they're occurring, and we're talking about things like prior authorizations, being able to reduce denials, things of that sort that are all, by the way, on the way up. If we can reduce that, we may have an opportunity to be able to have economic headroom to be able to then do things that are extraordinary. And to your point about the lack of clinicians, we are absolutely seeing that across the globe, but it is exacerbated in these underserved rural communities. And so what we're now looking at are AI solutions that could remove some of the things that clinicians struggle with. One of those would be documentation, obviously. We're trying to make it easier, better, faster with ambient clinical technologies. But the other is actually something that we haven't seen before, which is the acquisition of some of the information in a seamless manner. So I'll just give you a real quick example. I think much of us are familiar with there's so many chronic diseases, diabetes being one, cardiovascular. How do people get that type of treatment? They come into a clinician, they get a series of tests. Well, let's think about all those individuals that didn't come into the clinician, that actually have the disease or is progressed and they just didn't know about it. We actually now, through technology, have an ability to be able to screen these individuals with technologies that can look in the eye, the retinal image, obtained through a routine eye exam, and then be able to apply that and be able to identify these individuals. And it can be done in an automated manner, which is extraordinary. And I think we now are starting to see that this, when we talk about agentic AI, it could actually be used to remove some of the manual things that only clinicians could do to capture the information or through blood tests or other mechanisms, but now it can be done through automated AI mechanisms.
One more question for you, David. Are you seeing any appetite of governments in some of these underserved countries, low resource countries, to have at least explorations of that?
Yeah, absolutely. So what the technology I've described is called oculomics. It's essentially AI applied on retinal images, and it goes beyond diabetic retinopathy. We're talking about cardiovascular disease, hypertension, chronic kidney disease, a whole bunch of ophthalmologic conditions, even things like MS and Alzheimer's. And we're talking about incredible. And the reason is because one of the machines that is used to capture it is called the OCT, can go into basically the 3D image at the micron level to be able to identify blood vessels and nerves and surrounding structures. And with AI, we can do amazing things. But the initiative that is underway is about the real world application of oculomics. It's called Healthcare from the Eye. It is now actually being launched in the United States. It's being launched globally. And a large number of organizations are realizing they can do it. And why? Because it's not only amazing technology, but it's inexpensive. It's also something that's highly accessible, and it reduces the need for clinicians to be able to do a lot of that manual work. And so I think that this is actually a potential opportunity for us to start thinking about how technologies could transform the way that we deliver care.
Music to my ears as someone who, when I was in training, never could get a good visual of the back of the eye to the extent I was supposed to. Prem, it turns out that people in even low resource countries are having strokes, unfortunately. And are you beginning to have conversations with people, with leaders or companies or hospitals in some countries other than the most wealthy countries in the use of the kind of technologies that your company is deploying?
Yeah, Zach, that's definitely our goal, to be able to have more of those conversations. We're currently in the EU with some of our solutions as well, and continuing to grow that footprint globally is definitely top of mind for us. I think, like we said, our goal is, again, just to increase access to life-saving treatments, right? And ensuring that we're able to embed AI into those clinical workflows. And so whether it's in countries that are wealthier or, less wealthy countries, the goal is just to ensure that there's opportunities to allow for reliable detection and triage of these conditions, and anything we can do to help with utilization of AI to be able to do that, we would be more than open and looking forward to more of those conversations as we're expanding our growth across the country and the world.
Let me ask a crass question, which unfortunately in medicine, if you don't ask these crass questions, you're missing the boat, which is currently, where is most of the reimbursement coming for the use of these technologies? Is it hospitals who are trying to increase quality? Is it self-insured healthcare systems that are trying to reduce morbidity? What is it with the model?
Yeah. So primarily, right, I think what we see from our side of the business is really health systems that are looking to improve quality, to improve their opportunity to grow their footprint and capture of patients within their system. And a lot of it is tied to the evidence that you can generate, whether it's to show clinical impact, operational impact, or economic impact, as David mentioned, right? So I think being able to show that a treatment by improving time to treatment and diagnoses reduces a reduction in disability will give actually the hospital an opportunity to negotiate better reimbursement rates with their payers if they think about the ability to improve quality and outcomes. It also, a large majority of our solutions today have been direct to hospitals, and they're the ones that are paying for the solution. And we have received reimbursement from CMS, which is the new technology add-on payment to support with the adoption of new technologies such as ourselves, as long as the evidence is there to demonstrate the impact to patient outcomes. And so I think that's a key area where I think reimbursement policy around AI can really support with better adoptions act. But today, you're right, a lot of hospitals do bear the brunt of that overall as they're adopting these solutions.
Zach,
So
can I build off of that?
please,
Yeah. So
let
I
me
would
ask you a question
sure.
build off of that. Ambient dictation has taken medicine by storm, at least in this country. I've never seen such a fast adoption where no one but the hospitals are paying for it, because it's just making the lives of doctors so much better and the quality of their documentation better. Please answer what you were going to ever say, but can you add in, is there any evidence of a similar appetite for that kind of documentation adoption in other countries that have less resources?
Oh, absolutely. So maybe I'll start with that, just because I feel like that is the hot topic right now. Everyone's excited over the ability to use this technology to be able to capture the conversation, convert it into a note, save the doctor incredible amount of time, 5 minutes per visit, 50% of the amount of time. And I think that what we're starting to see is that this technology is something that could really transform the way that we interact with patients. And there's an intangible element to it as well. When you spend more time listening to your patients and having a conversation, you can uncover more things. And so it's not just about documenting what little conversation that you had because you have such limited time, but it's about having that conversation. It makes our opportunity to build that relationship stronger, and ultimately it can lead to some intangible benefits. But that said, it is absolutely being deployed, I'd say, globally. And what we're now starting to realize is that we can go well beyond simply just having the technology to solve one problem. As a platform, we can start envisioning having virtual assistants. In fact, that's something that was just announced recently, where a virtual assistant now helps you with that note and kind of add certain things at your command. And then on top of that, think about third-party integration. So all these things like voice as a biometric, being clinical decision support, identifying gaps in care, all of that could seamlessly be brought in. I mean, we've really struggled in terms of clinical decision support, trying to find ways to make things workflow compatible. And largely it's because it required interrupting workflows and doing a variety of things. But we're now realizing that some of these newer strategies can dramatically help. So that's one topic. But really building off of what Prem was talking about with reimbursement, I want to add that, we're starting to see some really interesting things occur. So first and foremost, some of these models actually have been FDA cleared, and there's also CPT codes. So with that in itself, like for instance, the diabetic retinopathy, that in itself pays for the program that we're talking about. The reimbursements are such that you can actually, depending on your commercial pay, with a certain number of patients, you'll break even, and then after that, you actually can start making money. So there's actually a benefit even in a fee-for-service world. But what we're also recognizing is that there's these, again, hidden benefits. At Stanford, where they'd been running this program, they saw a dramatic rise in the HEDIS scores. And the HEDIS scores for screening for diabetic retinopathy are very hard to get up, because it's not about whether you order it, it's whether the patient actually went and saw the ophthalmologist. And so now what we're doing is, because we have these abilities to really inform the patients, those HEDIS scores have gone from anywhere between 20 to 40%. And this is Stanford. I mean, it's a pretty good institution to well over 80%. And so what we're now realizing is that we actually have an ability to potentially improve quality measures, improve patient satisfaction, access to care, and maybe that ties into things like star ratings. And so we're actually now starting to look into that, which ties back into reimbursement. So there may be things that are out there that could ultimately lead to greater reimbursements, even in a fee-for-service world.
Prem, first of all, does that resonate with your company's experience?
Absolutely.
And who are typically the people in these hospitals who get it?
Yeah, so it definitely resonates with our experience. I think what's interesting is just seeing the use of the technology, right, and being able to impact those quality metrics is a huge component of the success you can have. However, at the end of the day, a hospital, just like any other business organization, still needs to be able to manage their margins and be able to continue to keep their doors open. Administrators are the ones that are more focused around these decisions, around what technology solutions to deploy, how to deploy these technology solutions, understanding the resource needs that are there, and what the overall impact is, right, on their program growth, thinking about being able to reduce leakage of patients, being able to ensure a broader capture opportunity for those patients within their network. But those are all key things that administrators at a health system level are very focused on, as well as more recently, right, there's been establishment, a lot of AI governance committees on the health system side, which is a group of providers there that include the CMIO all the way through the CTO, as well as a lot of the clinical teams that are involved in the decision making around thinking about whether the solution integrates into what they have available within their infrastructure today, and really being able to allow for a more process-oriented decision-making framework about how they bring in those technologies. But I think that the administrators, at the end of the day, they hold the purse strings on those decisions around what technologies to adopt, how much to spend on those technologies as well.
So regrettably, we're coming to the end of the time. So my last question is for David. It's a bit of a edgy question, but that keeps us awake.
Yes.
David, there are some low-resource countries or mid-resource countries that just don't have EHRs, don't have electronic health records. Do you envisage a possibility where the combination of ambient text capture, cloud computed AI support, where essentially the classical EHR is bypassed, it comes this other transactional system much more focused on supporting the doctor rather than other types of processes?
Yeah, we have an opportunity to be able to potentially leapfrog and not require some of these technologies that we have done in the past because we didn't have the ability to use AI. So there's really an extraordinary opportunity to think about how voice could become one of the next modalities for us to be able to capture the information, then use AI to basically find the information from that. But a lot of the information today is still stored in EHR, so it'd still be beneficial to have that so you can communicate with other organizations and we can have a level of standardization. But absolutely, we are definitely seeing a transformation today in terms of how we may be able to apply technologies to transform our workflows and ultimately lead to better health.
Great note to end on. I know for a fact that many would want this conversation to go on, but I've learned through long, painful experience, better leave them wanting more. So let me just thank you, David and Prem, for your time. This was at least a very good teaser about this. And I'm sure you'll have people approaching you about getting more in depth in this important topic. Thank you. And now let's turn to the next segment of our program.